Hello world, welcome to Open Heart Surgery. As you know, we're going to be talking about anything that brings trauma to the heart. Today, I've got a special guest. I'm going to let her introduce herself. It's on you.
Okay. Hi, I'm Bianca Williams. I'm 32 years old, and what else do I need to say? You can follow me on here.
You could give your shout out like
Okay.
your page.
Okay, yeah. You can follow me on Instagram at Hair by B Wheels at HAIRBYBWILLS. Hair by B Wheels. I do hair. I'm a master cosmetologist.
Good. So basically, we're gonna just dive right in. A lot of people, when they hear open heart surgery, they automatically think of the emergency room. They think of physical surgery. So I just want to ask you, when you hear about open heart surgery, what comes to your mind?
Like you said, like when you first hear about it, the first thing you're gonna think of is the emergency room, the hospital, fixing something that needs to be fixed, something that is messed up, and you're going in to correct it. So that's the first thing I think about.
So first we're gonna break things down. So when I first thought about, doing this segment, I thought about, a lot of us, our hearts are failing, our hearts are aching. We got a lot of confliction with our hearts, and so I'm like, we need surgery. We need a doctor, and most of us feel like you gotta have a degree to be a doctor, but really, it's just really a simple conversation. Yeah. So that's why we doing this. That's why we're doing this segment, because just really just talking about your issues, bringing them to life, and fixing it. So when I say surgery, I'm gonna tell everybody the definition of surgery. So surgery is the treatment of injuries or disorders of the body by an incision or manipulation, especially with instruments. Sometimes when we have failed relationships, when we have not even a physical relationship with a man and female, but a friend, relationship with your friends, your family, your mother, your father, we get cut deep. We get injured and we need healing. But we go through the process of manipulation, of manipulating ourselves by saying, no, I'm okay, by burying it. So I wanted to get that out, what surgery was, what does it mean. Also, I wanted to give the definition of incision. Incision is the action or the process of cutting into something. Sometimes once we get cut, we so afraid to go back to that place. We so afraid to go deeper because that minor pain that turns into major pain when we could have just dealt with it right then and there. Yeah. So what we're going to talk about right now is we're going to talk about the trauma that comes to our heart. We're going to talk about getting that first incision. We're going to talk about getting our surgery and the recovery process and the healing. So Bianca, in your life, we go through a lot of things that happen to us and things that we just went through. Yeah. So can you reflect and let us know some of those things?
I can honestly say I've been through a lot. I'm 32. I've been through a lot. But like she said, going through like the different stuff, like with friends, family, relationships. I can say one thing is I got pregnant out of wedlock, so that was one thing that probably hurt, and I know it hurt me, hurt my mom, and her, different people that was around me, and relate, like you said, like it can be relationships, it can be, I mean, what do I need to pick one, or
Yeah, just pick one that you buried, one that you don't really talk about, one that is going to be like a new topic to really talk about. Something that you just like, I went through it, I ain't paying no mind, but from time to time it still surface.
Okay. Well, I can go back to when I was a kid. I probably was 9 or 10, and my daughter is 9, so I was about her age, and I was molested by cousins.
Wow.
And they was older than me. They was probably about, if I was 9 or 10, they probably was about 14, 15, something like that. But my mom and my dad, they work all the time. Like, there's one thing about my parents, they stayed, working. They had a job.
Typical
They,
black household.
right. they made sure we was good. And around that time, it was summer. Me and my sister, we didn't go to daycare, so my mom's aunt kept, she watched us or whatever. And she was an older lady, and she didn't have any kids, but there was a lot of kids around her. A lot of my cousins, a lot of her, nieces and nephews, they would all be over there. And it was just basically, you just got this old lady, and then a house full of kids. So it was a lot going on in that house.
She couldn't keep up what's going on.
She didn't. She could not keep up. And we would get there early, and all of this would be happening while she was asleep. She would be asleep. And I was getting molested every day for a whole summer.
Wow.
And it was crazy. Like, it would start with one, and then I guess he would tell the other one that, what was happening. Wow. So it would happen, and the first thing, and looking back on it, that's why, and I can honestly say this, my mom and my dad taught me, like, early, if somebody touch you, you let me know. If somebody put their hands on you, you let me know. If somebody try to kiss you, anything, you let me know. And I promise to let them know. Like, I vowed, I'm gonna tell, you young, like, they ask you, did anybody do this? And you say no. And at the time, nothing was happening. So when it finally happened, I was so scared to tell. I did not tell.
Although you let them know, I'ma tell. I'ma tell you, mommy, daddy, whatever you say, I'm gonna tell you.
I'm gonna tell you. I promise.
You did not tell them.
But I did not tell them. And you know how you hear different, like I hear it now. People tell you, like, they'll say, if you tell, you're gonna get in trouble. They're not gonna believe you, and that's the God honest truth. That's what they say, and that's what I was told. If you tell, they're not gonna believe you. If you tell, you gonna get in trouble because you let this happen. You let me do this. I'm 9. I'm 9 years old. Like, how can I? Like, that's the crazy thing ever.
And
that's crazy.
And that's good that you said that, because so many people, they have their kids and they like, oh, they leave them different places. Oh, they'll let me know if something going on. When really, no, they may not. You live in proof that something happened and you did not say anything.
I didn't say nothing.
And you were taught to say something.
Yep.
But I guess us as adults, we have to realize that our kids can't fully process what we're saying to them. Like, your mouth is saying, yes, I promise I'm going to tell. But when that trauma happens to you, you like, oh, I changed my mind.
Yeah.
And it happens even, I was doing a study, it happens even with adults. Like, some females get raped and they don't come out until a month later.
Yeah.
Or they don't go tell the cops until a week later. They got raped last week.
Yep.
So if a grown person can't handle this, how can a child handle it? And I want to share some information with you, because we keep saying trauma. Well, there's 3 types of trauma. You have acute trauma, which is trauma that happens from like a single incident. And then you have chronic trauma, which I believe is the trauma that you have been through. which is a repeated and a prolonged trauma, such as domestic violence or abuse. And like you said, this happened to you every day.
Yeah.
In that summer, like I can't imagine. Like if that ain't trauma for you, I can't imagine, because some people it happen one time.
Yeah.
And it send them into a space where they can't come out.
Yeah.
And here it is every day.
Every day.
Well, we got 3 months in the summer.
Every day.
That's over 90 days. And then last you have the complex trauma, which is exposure to various and multiple traumatic events, often like an evasion or interpersonal nature. And you can kind of, your situation can kind of be complex as well. But I think that chronic really does it because it's repeated.
Yeah.
It's repeatedly. And then now what wasn't normal becomes normal to you.
Yeah.
Now you feel comfortable with it.
Yeah.
And that's
because you know it's gonna happen.
Exactly.
Like, you know, the first you like, oh my God, like you go into like a shock, like what the world, like what just happened, and then the next day you like, oh my God, it's happening again.
Right.
And then as it continue to happen, it's like, well, I know this gonna happen. Like, I know what I'm gonna expect when I get here. I know, you know, and it's a blessing when you know that person not there today. You know what I'm saying? Like, okay, at least I get a day. And it's crazy talking about it now, because, you know, back then you were a kid, you ain't thinking like that. But now talking about it and thinking about it now is like, it's like a relief. Like, oh, you know how you in school and that bad kid who just interrupt everybody, and then the day they ain't come, now you like, whoo, like today gonna be smooth. We gonna get to have ice cream today. We ain't gonna be on silent lunch. We ain't gonna have to do none of that. Like, we get to chill today, and that's honestly how it felt. Like, it's crazy.
So I'm gonna tell you right now, you are in surgery right now. You are on the operating table. The first step was that cut that you reopened, that incision that had to be made when you doing open heart surgery. You just repeating what happened to you was you revealing that cut. So now you here, you in surgery, your wound, everything, your body is open. Yeah. Everything is open. You're putting it out there. That's one of the first steps. Yeah. So we done cut it open. We talking about it. Do you or have you did you blame yourself? Did you blame anybody?
I can tell you, we had this conversation a couple of days ago, and I shared to her, like, my husband don't even know. Like, and it's crazy. He don't know now. Like, he gonna see it now. Oh my gosh. So that's another conversation. But at that time, like, I was so mad, like, why we here? Like, and you a kid, so you know your parent gotta go to work. Like, I used to say stuff like, I'm sick today, I want to go over there today. You know, it was too much. And when I got older and stuff started, you know, like the thoughts started coming back. Like, now I'm a teenager, and now I'm trying to deal with teenage stuff, and it's taking me back to when I was a kid. So now I'm getting mad, I'm angry. If I see him, I'm ready to go off. I'm mad at my mom. Like, why did you leave me there? I'm mad at my dad. Just thinking about all that type of stuff. And I just told Shada a couple of days ago, like, I had that thought as an adult. Like, I thought about it a couple of weeks ago, and I put my child in that space, because I was like, my child is the same age that I was when I went through it. So thinking about it, I got mad all over again. Like, I started crying. I was like, it was like because I never dealt with it. Like, I've never just dealt with it. I never, I didn't go through therapy or, go through stuff like that. You just bury it. It's just like, oh yeah, that happened to me too. And so thinking about it again, a thought like, the devil tried to bring to my mind that it's your mama's fault, it's your daddy's fault. My dad he died in 2005. So I can't go get mad at him. So now I always love my mom, and that's the first thought the devil brings, is your mama's fault. And you know, being an adult now, it's like, no, it's not my mom's fault. Like my only thing my mom did, she taught me what I'm supposed to do. She told me what I'm supposed to, you know, if something like that happened, what I'm supposed to say, what, you know, come tell them. So my mama didn't do nothing wrong.
Right.
She didn't do nothing wrong. And that's that thought, like the devil tried to put back in, like, yeah, go get mad at your mama. Just for what? Right. My mama had to work, and she told me what I was supposed to do. I just didn't do it.
Do you blame yourself that you didn't do it, or have you blamed yourself like, well, dang, I should have told? Or, why didn't I tell?
Yeah, I blame myself, and I think at this moment, you kind of deal with it through the years, but I used to be like, why didn't I just say something? Like, why didn't I just scream? Why didn't I do none of that?
So it's a word that I came across, and then do you know what a surety is?
What?
A surety is spelled Surety.
No, I don't know what that means.
Like, have you ever like if you had to bail someone out, or you were like a co-signer on a loan, like you would sign on the surety signature.
Okay.
Like a surety is basically one who makes himself or herself responsible for the obligations of another. To simplify it, like a person who takes responsibility for another's performance or another's action. So saying, when you sit here, you say, hey, I blame myself. Like, I could have screamed, I could have told. I broke it down to like, surety causes surgery. So when you put yourself into the position where you take ownership for somebody else's actions, meaning it's not your responsibility, it wasn't your fault, they shouldn't have been doing that to you anyway. Whether you told or not, you should have never even had to encounter that. So the first time, and we do it a lot, the first time trauma happened to us, we blame ourselves. We become the surety. We take the responsibility of that action, and it weighs on us from another person. So they're not walking around guilty. Like they doing this, they keep doing this. They're not guilty. But we walking around, now you walking around with the pain from the trauma, and you walking around with the responsibility that you just took from them, from their actions. So when I came across this word, I said, wow, like, being a surety makes it causes you to need surgery, because it causes you to need healing. It causes for you to open up, expose, and realize that I didn't have nothing to do with this. I'm not the reason that it happened to me. I'm not the cause. And because I didn't say anything, or because I didn't scream, doesn't make me responsible.
Right.
Like, to this day, your mom is not responsible.
Right.
Your dad is not responsible. You are not responsible. The person who did this to you, the people who did that to you, they are responsible. And you going through your healing, you have to realize that. And sometimes in our Black culture, we think like depression is weak.
Yeah.
We think that talking to a shrink is weak.
It's weak. Yeah.
Where really it's not. We need to recover.
Yeah.
So even if you had to put a sticky note on a mirror every time you wake up saying, I'm not responsible. Like, this happened to me, this happened to many people, I'm not responsible, it's not my fault, and I done got through it. Because this happened maybe 20 something years ago.
Yeah.
But like, look at you today.
Girl, I'm just trying to live life.
So everybody that's tuned in, I really hope that you guys understand the word surety, and let that be something that you tell yourself, like, I am not responsible for what happened to me, what I go through. I am responsible of how I go from here.
Yeah.
So like, during these different segments, you're going to see different people go through surgery. you're gonna see them recover, and they're responsible for their recovery process. When you go to a doctor, you get surgery. What they give you post notes.
Yeah.
On what to do to prepare for your surgery, and then afterwards they give you notes on how to maintain, what medicine to take, what not to do, what you need to do. So with this one, we want to say surety causes surgery, and if we already dealing with the surgery right now, we don't want no more surgery. So we're going to, from now on, for what, let's say the next 6 months, we're going to talk to ourselves, we're going to encourage ourselves, we're going to speak, and we're going to let ourselves know that we are not responsible.
Yeah. And prayer helps.
Yes.
Prayer. That helps.
Prayer definitely helps. I think that's kind of goes into like talking to yourself.
Yeah.
Like when you talking to yourself, you kind of talking to God. He hears you, and then you just talk to Him. Sometimes I don't even pray. I just be walking around talking to God.
Yeah.
Like that's my prayer. I'll be having a whole conversation with Him. But the last question I wanted to ask you was, knowing what you know now, what would you say to yourself, or what advice would you give yourself?
What I give to myself now, the advice I would give to myself now is to I think the advice I just live in your truth. Like, Bianca, don't hold stuff in. If you feel in a certain way, let it out, let it be known. Don't because your feelings, you don't owe anybody no type of explanation about how you feel. So the best thing is to let it out. And that's basically that's growth. Just grow, Bianca. Be you, Bianca. Nobody else, Bianca. Be you. Right, be you. That's just do it.
That's really the best advice.
Yeah.
There's strength in weakness.
Right.
I believe that there's strength and weakness, and if you just be yourself and be who you are, like you're sitting here, you're a woman today, and you're just being yourself, like you're bold. You're like, damn, I've been hurt. I've done wrong. I've overcame that. I'm strong. Like, it's so many people can't embrace that.
Yeah.
Like, so many people be like, well, dang, if I say this or if I tell that, then I'm gonna look weak, or I'm gonna look like, oh, she been through that. But you're here and you're embracing it.
Yeah.
Like, look at me. Like, I've been through that, but that ain't kill me. That ain't stop my growth. Like, I'm married.
Yeah.
I have a child.
Yeah.
I got a business. Like,
yeah.
You doing it.
I mean, girl. But like you said, we still have that, okay, I don't want to seem too vulnerable. Like, you have seen that from me. Like, I ain't finna show shot of that. I'm not finna tell shot of that. But it's so much, like you said, when you you never know what, that weakness that I had, I've shared it with different people, friends, and at that moment, that weakness that I was going through, Shada was there, and she saw it, and it was like, girl, you ain't got to be strong all the time, and that's the type of stuff you need to hear.
Right.
And like you said, I'm bold. I'm very bold. I'm very outspoken, but I also have those moments. That's when it's best to have those people around you. Right. That's going, they gonna carry that weight. That weight may be too strong for you to pull at that moment, and that's when you have that person. But that don't mean you weak though. That don't mean you. I still be trying I'm a G, but
I'm a G.
But just so thankful just to have people around you that can help you in those weak moments, and that's to support you during those times. So I'm grateful.
So that's another thing for them to do as they in their recovery process.
Yeah.
You know, surround yourself around people that, you know, are there for you, that can help you.
Yeah.
And if you don't have those people, it's okay. Like right now, they got a lot of stuff on YouTube, a lot of stuff on social media where you can watch videos, get motivated, and just tune in. Or, you know, you always got that one person. You got God who's always there. He's listening. Talk to him. Pray to him.
Yeah.
It works, right?
It works.
So
it works, honey.
So I know we probably didn't heal everything.
Yeah.
But we cut you open.
Yeah. You cut me open, girl.
We opened you up.
Cut me.
We stitched you back up and we let you know a few things, you know, to handle.
Yeah.
For your recovery process. And we is going to check back in on you to see how this process is going.
Oh, yeah. Yeah. We're going to come back with another video.
Right. The other one might not be so serious.
Yes, because this is a little deep. We like to have fun. This is a little deep. Woo!
We gotta get deep. Then we're going to have some fun, y'all.
Yeah.
So until next time on Open Heart Surgery, stay tuned. Tune in for the next episode. Tell Bianca, y'all catch her later.